Hi, Jonathan.
Hi,
Nice
Elizabeth.
to see you.
Great to see you.
I know, it's so fun.
How do you like Deloitte?
The worlds collide. It's good. It's been really busy. Obviously, we're doing lots of assistance for COVID response and whatnot.
I can
So
imagine.
it's been insanely long days, but good stuff.
Well, I think we could talk about, we were there at the origins at OPR and their climate resilience response.
I know. And some exciting stuff finally came out that I worked on a year ago, but just got published like a week ago.
Send it. I want to see what you wrote.
Yeah, no, it was the update for the comprehensive plan or the general plan guidelines in environmental justice.
Oh, that's great.
But there were some really good case studies that we had done a year ago. So I'm excited they're finally out there in the public space.
That's wonderful.
I'll send you the link. It's good stuff.
Please do. Hello, everyone. My name is Jonathan Parfrey. I'm the Director of Climate Resolve, and I'm very pleased to welcome you to the fifth class of Insurance 101 for climate activists. And I think it's been a really instructive course thus far. We have one more class to go after this one. We're going to have a class on next steps. There are some speakers who will tell us about the initiatives in the Department of Insurance in California. We're also going to have some presenters on insurance and equity, presenting some real-life examples of sort of past racial inequities associated with insurance industry and how we could rectify that in our new sort of climate initiatives, and also some activists who have been challenging the industry itself to divest from their investments in fossil fuels as well as underwriting fossil fuel projects. As it seems that the more that you invest in fossil fuels, the more climate problems we have. So I just want to remind everyone that we're going to be taking a few polls, that we're going to be opening up the webinar for Q&A. We're also going to be having some small group breakouts. So please be prepared to participate. And last but not least, we want to thank our sponsors. And that includes the LA Department of Water and Power that is graciously underwritten a part of this class, as well as the Resilient Cities Catalyst, a very important initiative out of New York City. And you're in for a real treat today, because I know Dr. Elizabeth Baca, who is one of your speakers, and she's going to be getting at some of the more difficult health questions related to health insurance and climate that I'm sure that you've been thinking about during this course. Without further ado, we have our instructor, Wendy Nystrom. And so Wendy, thank you for everything you've done in the last 4 weeks, and we look forward to today's class and then next week's our final class. Thank you.
Yes. Thank you so much. And again, thank you to Climate Resolve and everybody that participated and helped get this together. Dana and Michael, you guys have been wonderful. Jonathan, just meeting you back in December, January, this has been a great event for us. So let me share my screen, and we can get started. So this is our 5th class, Human Health and Heat. It was originally going to be our last class. We changed that to having a 6th class next week, same time, same place. And it's going to actually focus on the next steps and social injustices. With the next steps, we actually have a guest speaker who's representative of the Department of Insurance. Louis Blumberg has agreed to speak. He's been involved with their workshop for the past year, addressing climate change, addressing sustainability, and how insurance is responding to that. We also have an activist from Insure Our Future. She'll be speaking as well. And a dear friend of mine who is actually writing a book about injustices with respect to insurance and claims handling. So all of that information will be sent shortly with respect to our future agenda. Today's outline, just a quick review of everything we've encompassed. So from class 1 to present, we're just going to do a quick review of that. Talking about the chain reaction that I discussed earlier regarding greenhouse gas effects, pollution, and everything that's been happening. Case study of the San Joaquin Valley, very brief overview of that. Then I get to introduce Dr. Baca. She is with Deloitte, and she has quite a bit of information with respect to climate change, human health, and health care. So full disclosure, I'm a property and casualty gal. I am not a health insurance person. So her expertise is greatly appreciated because she knows much more about this than I would. And then I'm going to go back and just rediscover our captives and parametric insurance models that we were discussing and how they could translate to healthcare, how they could not translate to healthcare, and just kind of move forward with those models we were working on. So without further ado, let's get into our review. The insurance basics. So this is going back to our very first class, what a policy limit is. That's the maximum amount you're going to be paid on your policy. Your deductible is how much that the insurance company is going to take as, deduct from your claim. Or the self-insured retention, that's the amount that you have to pay before your insurance company will participate. It's usually for larger companies, and self-insured retentions are much larger amounts, usually 100,000, 150, up to $1 million, depending on the client. You're the insured, that's you. You are the client, you're the company, you're the one, in contract with the insurance carrier. The insurance carrier is the insurer. So just so you understand the dynamics, the insured is you, the insurer is the company. Risk is your possibility of loss. Peril is your cause of loss. So peril meaning fire, flood, storm, surge. That's what people usually refer to as a peril. Liability, who's taking responsibility, and is just overall concept of just do no harm to others. Loss is the basis for all damages and claims. Bodily injury is your illness and disease, including physical injury. It can also at times include mental illness or mental damage. And property damage is always going to be your third-party damage with respect to a property policy. So it's not going to be, you can't destroy your own stuff. It has to be a third-party damage. Real quick on general liability. So commercial GL, third-party bodily injury, property damage arising out of premises, operation, and products and completed operations. This will not cover professional. This is only going to be someone's at your site, slip, trip, and fall, they get hurt, or a product that you made or a product that you were selling causes them some kind of damage. Property policies, we went through all the HO1s through HO7s. Real quick, the most important one, the most common is going to be your HO3. That is your special open peril basis where they say everything's covered until you read your exclusions. So always, always, always read your exclusions. Same thing for the commercial all risks. They call it all risks, open peril, special risk. It basically says everything's covered except for those excluded items. So you want to make sure you check those excluded items just to make sure that everything is covered that you expect it to be. Reviewing the FAIR plan, so state run or not owned by the state, but it is offered. It's a dwelling policy that's very limited. So you only have $1.5 million for policy limit. It's actual cash value. So that means what the item that was damaged, what's it worth now? Not to replace it, but if you bought a television 3 years ago, they're going to say 3 years ago you bought it for $2,000. Nowadays it's only worth $1,500. So the actual cash value will be that $1,500. So you want to be aware of that because that's not going to replace the item. And then the commercial policy is only $4.5 million in limits, $3 million for structures. and then the 1.5 for all other coverages. So again, it's actual cash value. Not a whole lot of coverage there if you have a commercial building. So some people, offset this by buying excess coverage, but it is limiting, and it's a last resort. If you cannot get coverage elsewhere, you can go to the FAIR plan. And then the business owner's policy just is a little more encompassing. The limits are only $2 million, but it does cover your contents, does cover your business liability coverage, and it's a named peril policy. Moving through our regulations, if we recall from our pollution class, we had the case studies of Times Beach and Love Canal, hugely contaminated sites. People got very, very sick. And this was what kind of started CERCLA and RECLA, starting the super funds. So federal funds actually being used for cleanup. This is a chronological order of all of those regulations that started, starting with NEPA, ending with SARA. SARA just basically added to the existing CERCLA to further process the funds, have a little more oversight and watching where those funds went. Pollution exclusion. So as a result of these contaminated sites, these are hundreds of millions of dollars that was spent in cleanup, and people just triggered their general liability policy or their property policy as coverage. Unfortunately, insurance carriers had never anticipated to be covering that. So there was massive losses, similar to what we're seeing now with all of the perils that are being exacerbated by climate change. So there's a little parallel going on here. So what we saw back in the 80s is they added a pollution exclusion. So any bodily injury or property damage arising from actual or alleged, so remember, it doesn't actually have to happen, it has to be alleged, or threatened spill, discharge, emission, dispersal, seepage, leakage, migration, release, or escape of pollutants. Extremely broad definition there. And then if you look at how they define a pollutant, solid, liquid, gaseous, thermal, irritant, so heat, contaminant, including smoke, odor, vapor, soot, fumes, fuels, alkalis, acids, chemicals, and waste. And waste can include anything to be recycled or reconditioned or reclaimed. So very, very broad definition that could exclude quite a bit. And as a result, those holes in the coverage were filled with your contractor's pollution liability, pollution legal liability, or site pollution. Different scenario there, but something to focus on is we had a large loss, coverage that was not anticipated was now being covered. So it's excluded because it's just too much loss. The insurance carriers could not handle it, and a new product created. So that's what we've been moving forward with on these classes, is trying to think of something new, trying to create a new product. So just reviewing our risks that we've been discussing, drought, wildfire, floods. So the first one we talked about were droughts, primarily an agriculture risk, but as we're going to learn today, it's also human health risk. People are getting very sick. We are now seeing this happening every 2 to 3 years instead of every 20 years, so it is getting more severe. Same with wildfires. Great picture of California with all the wildfires that were in 2018, I believe. This is part of our chain reaction. So in the 1880s, the Industrial Revolution had more pollutants emitted into the atmosphere, greenhouse gases going up, greenhouse gas effect. And then what happens is we get hotter and drier. We get, with that more heat, you're also going to get more precipitation. So this is all kind of interconnected. Higher heat index, we do get longer growing seasons, but drier conditions lead to those fires. And again, once we're considered catastrophic, considering every 5 to 10 years, it's now happening every single year. And in 2018, wildfires had $24 billion in losses. Same with the thunderstorms, hail, and tornadoes. This is a graph showing each color represents a different year, but you can see overall, every single color is going up. So we're getting more and more severe storms, more catastrophic as the years progress. So actually onto our first poll. I think Dana's going to pop that one up. So should there be a federal agency similar to CERCLA? So remember, CERCLA was what created Superfund sites, gave federal funds to help clean something up. So should there be a federal agency created for managing loss caused by climate change? So end results, we're sharing our polls now. So we have about 90% saying yes, 10% saying no. It's a complicated question. So, who would create it? Where would the funds come from? How do we even identify climate change? What would be those perils? But it's just something to think about. So maybe there's somewhere out there that could be either created, or funds from another area that aren't being actively used could be actually used towards responsiveness or resiliency to climate change and some of the devastating effects we're seeing of that. I think I can close that. So discussing the chain reaction, this is something that I've been talking about for the past couple classes, where we start with pollution, basically greenhouse gases being emitted into the atmosphere the past 100 years. That leads to excessive heat, but simultaneously that heat also allows more absorption of precipitation into the atmosphere. So that's where you're getting your altered jet streams, you're getting floods, storms, and surges, in addition to heat causing droughts and wildfires. So we have two kind of a split chain reaction that's happening depending on where you are in the world. So everything's being connected. So average temperatures across the United States have increased 1.5 degrees since 1895, and it's accelerated since the 1970s. We all know the 70s, where there was a lot of smog, a lot of pollution. So, it's no surprise that that caused an acceleration. And in the past 50 years, weather-related natural disasters have tripled. So we're seeing all of this chain reaction as a direct response to our climate change happening, which is something we really do need to address now and start identifying it and responding to it. So with this increased heat, and we'll go into that more with the human health issues, but you're going to have heat stroke, dehydration, compromised outdoor labor and work environments, water scarcity, drought and famine, and again, with the prolonged growing season, you get wildfires because that all dries out and becomes kindling. So it's exacerbating this existing risk and making it much worse. Same thing with storms. So you had a rise in sea level, as I showed with one of my case studies in Manila, is everyone started just building their houses higher up. So their ceilings became their floors, sinks were now on the ground rather than being waist height. They just kept building up. Not exactly a sustainable response, because eventually you're going to not be able to build much higher. So more than half of the world's population lives within 60 kilometers of the sea. That's pretty close. So we're going to have a lot of people greatly impacted with rising sea level. Destroys homes, healthcare facilities, and other essential services. People won't be able to get to certain places anymore. You won't have access to clean water if you get polluted water infiltrating the water supply with that rising sea level. Waterborne diseases will increase. You're going to have breeding grounds for mosquitoes, Lyme disease, things like that will start being more prevalent. You're going to have coral destruction. Coral only survives at a certain temperature and height in the ocean. So when you start making it too deep, you go below something called the calcium compensation depth. And that when you get below calcium compensation depth, it dissolves. So that's another problem with trying to build up coral reefs and saving them, as we were discussing with Dr. Beck last week. And then glacial melt. This is something relatively on topic. A couple weeks ago, Siberia hit 101 degrees. That's extremely unusual. So with this 101 degrees, we're seeing our glaciers melting, and it's releasing methane gases. And it's repeating the cycle because the methane gases are again going into the atmosphere, greenhouse gas effect, and then increasing temperatures even more. So we're kind of getting into this vicious cycle of just everything repeating on itself. Which is where I come to, I think, my favorite diagram that I found in all of this. This is from the CDC. So in the very center of this diagram, and I just named it the vicious cycle, but the very center, you have heat, storm, flood, looks like tornadoes. So that very center is our core issues that we're seeing. And then you go one center out, you have more extreme weather, rising sea levels, increasing CO2, and rising temperatures. Then you go out again, and here we are exacerbating a situation, creating more destruction. Air pollution, changes in vector ecology, increasing allergens, water quality impacts, water and food supply impacts, environmental degradation, extreme heat, severe weather. And now you're getting out to the human health element. We have injuries, fatalities, asthma, cardiovascular disease, heat-related illness and death, forced migration. Think about that. People are being forced to move from where they live. And in the case study I'll be discussing, there's a mental illness issue with that. People are being forced from their homes. Malnutrition, cholera. So this is, you'll see this graph, this diagram a few more times because I keep wanting to hit that home that this is a chain reaction, everything is related, and all of our activities are exacerbating the situation. So the case study is San Joaquin Valley, and so basically I found this in the American Journal of Public Health from April 2018, and it's about climate change, public health, and policy. So we have a population, San Joaquin is known as the salad bowl, fertile soil, large amount of produce is grown there. They have a population of 3.9 million, and 1/5 of the households in the region have incomes below the poverty level. So 30% of the population do not have a high school diploma. And the heat in the valley has increased by 3 degrees in the past few years. So if you remember previous slide, since the late 1880s, worldwide, we've increased 1.5 degrees. This valley alone has increased 3 degrees, which is quite dramatic in such a short period of time. There's a persistent decline in precipitation. There's a continuous drought, and farmers had to dig 1,800 feet down to get to groundwater to be able to tap their groundwater. So continuing issues, drying out. As a result, the land has subsided. So that just means, if you remember the Dust Bowl from the 1930s, the soil's basically going away and everything is kind of sinking further and further down because there's nothing to hold that soil together. So it's just blowing out. So the land is subsiding, increased pumping of groundwater, drying out conditions, and some of the areas has sunk by 28 feet. So in the image below, you can see there's a fire hydrant with a dog looking up at it. There's also a telephone pole that has 1955 way up high, and then present day, which seems to be from the 1977. So it's probably dropped even more. Wasn't able to find a more recent photograph that had that same pole. But this just shows you how much of that soil is being removed, how much of that area is being depressed down just due to lack of water, lack of soil retention, and just drier conditions. And the Office of Emergency Services reported 1,612 cumulative domestic well failures in the Tulare County alone. So that just means there's no water. The groundwater well is dried. They could not find more tap water. So going on to our second slide on this, heat-related emergency room visits range from 17 to 28 per 100,000 households, and the national average is 11. So people are going to the emergency room more frequently. People are getting sick more frequently. And it's all primarily due to fatigue and respiratory illnesses, fatigue from being in extreme heat. It's very hot, it's very dry. So the air quality also is one of the nation's worst. So think about all that dry air, dry conditions, soil blowing out. So people are getting sick from the particulate matter going into their lungs. It's also causing cardiovascular disease and exacerbating asthma. So you have heat waves, dust storms, changing weather patterns. So it led to what is called a 6-fold increase in valley fever. And valley fever is a disease caused by a fungus in the soil. So again, we have this chain reaction all related to climate change that's going through the process of, air quality, water quality, quality of human life, heat, exacerbation, people are getting sick. So all of these are interconnected with each other. And again, my favorite graph again, because I'm just going to keep going back to it. This will also lead to mental disorders, psychological distress, ongoing worry. Again, people are being removed from their homes. They had to leave, these are generations of people that lived in the same place, and now they're being uprooted. There's no water, there's nowhere to live. So you're gonna have trauma, shock, stress, grief. Substance abuse is also a big problem, post-traumatic stress, and suicides. There is also a sense of desolation and loss of identity when someone has to move from their ancestral home, or if an area becomes uninhabitable. And then indigenous communities, low-income groups, women, children, older adults, individuals with disabilities, and those living in high-risk areas are more vulnerable to the mental health impacts of climate change. So that is sort of the ultimate end of not only your physical illnesses happening, but you're going to have mental disorders and people under severe distress. That should absolutely be part of this entire equation we're trying to work out, is addressing the situation. It's all being started by climate change. We need to fix it, we need to address it, and we need to find a solution. So one of the things, we have another graph that pretty much has the same thing as that previous one. Instead of spiraling outwards, This is talking about climate drivers and how it affects human health. So increased temperature, precipitation extremes, etc., extreme heat, poor air quality, reduced food and water quality, changes in infectious agents, population displacement, what we talked about, you have to move your ancestral homes. And then health outcome is the, heat-related illnesses, food and water, vector-borne diseases, mental health consequences, stress is a big deal. So all of these are interconnected with each other with the environmental and institutional context, social and behavioral context. So this is also in the notes that you were provided on the PDF that Dana sent you, so don't worry about writing all this down. But you also have your left and right factors, key factors of influence. So it's just something to understand with everything being related and intertwined with each other. I believe we are now due for our second poll. Yes, we are. So this is our second poll. So the case study we just had touched on psychological disorders resulting from climate change. So should insurance carriers be required to offer free and confidential mental health services? And again, confidential is very important because if people don't trust the information they're giving out, they're not going to be honest in how they're feeling. Okay, so 79% said yes, 21% said no. Mental health can be a touchy subject. Some people aren't comfortable discussing it, but I think it's important that people do address it. Suicide is happening. We are seeing increases in that, especially now. So personally, and this is just my opinion, I think it's important that people do discuss mental health and they get the help that they need. And if a carrier is offering it, then that would be even better. On to our, let me close this. So I believe this is our introduction to Dr. Baca. So have her bio. She's incredibly intelligent. I have enjoyed every conversation I've had with Dr. Baca, and just getting to talk to her on the phone and over Zoom has been a pure pleasure. So thank you for that. But here's her background, her bio real quick. So Dr. Baca is a specialist leader at Deloitte, providing systems thinking and insights to healthcare and life science clients. Dr. Baca studied health policy at Universidad Simon Bolivar in Venezuela. I apologize for that. My pronunciation is terrible. And completed her master's in public administration at Harvard Kennedy School of Government and her doctorate of medicine at Harvard Medical School. She completed her residency in the pediatric leadership of the Underserved Plus program at University of California, San Francisco. Dr. Baca served in both administrations of Governor Brown and Governor Newsom, first as Senior Health Advisor and then Deputy Director in the Governor's Office of Planning and Research for California, working on a variety of projects addressing the social, economic, and environmental factors that impact health. In her role with California, she has provided leadership and guidance to several initiatives, including the California Initiative to Advance Precision Medicine, the Global Climate Action Summit, and the California Healthcare Climate Alliance. Dr. Baca has served in several national and global advisor roles, including with the Urban Land Institutes and Health Leaders Program, as advisor for Food System 6, a food system accelerator, and as a contributor and member of the Biotech Futures Council for the World Economic Forum. She has been a contributing author on several publications, including the National Academy of Sciences, formerly the Institute of Medicine, Consensus Committee for Communities in Action, Pathways to Health Equity, Demystifying Big Data and Machine Learning for Healthcare, and Precision Medicine and Action Plan for California. So Dr. Baca, please, I will stop sharing my slides and you can share yours.
Great, thank you. And it's really fun to be here with everybody today and to get to do some work with Wendy and with Climate Resolve. I'm based in California, so I've been in California for a number of years, and it's fun to be doing some work that's with a lot of Californians. I looked at the list of folks in the class, so it's really fun to get to do that. I'm gonna share my screen. So let me know when you can see my slides. Are they up?
They are. You just need to put it in presentation. There you go.
Perfect. All right. And I'm going to minimize us over here. Try to move this over here. It's the Zoom, all the technology, making sure to get out of the way for the presentation. So really quickly, you know, I think there are a couple things I'd love to cover. I think, you know, as we talk about heat and climate and health, I don't think, you know, in a lot of the slides that Wendy was going through, you can't separate out in just one piece. And so what I hope to do is present kind of a broader overview of climate and health. We'll spend a time specifically on heat impacts, which you guys are studying class. And I'm going to share some really interesting insurance information from a survey about specifically around health insurance. And then the last piece will be the future of health and solutions. So just go ahead and kick it off. I think one of the first things is that, you know, we're all doing this by Zoom, so it's an interesting time. But I think, you know, there's actually been a lot of parallels with the COVID-19 pandemic and climate change. One is a lot of, you know, I think one of the big things is like there was a lot of people saying, oh, this could never happen. I will say, for instance, in the health innovation space, people said, virtual visits, it's not really going to be a thing here. I'm working with a client who went from somewhere around 1,500 visits a day to 45,000 visits a day. So I think what's been really interesting is we've seen acceleration in certain ways that we thought, you know, for so many years, people said, oh, that can never be done. So I think there's that parallel. I think the other parallel is that if we think that what's happening right now with the pandemic is bad, and I keep saying this when I'm having conversations, it's like, wait until we see what happens if we don't take action on climate change, because as we'll talk about, there's a huge force multiplying factor. And I know you guys are all working on climate change, so I'm saying this to a group of friendly folks that are thinking about this, but I think there's a lot of lessons to be learned in terms of response, preparedness, and resilience as we think about the overlap. You know, the other thing is just in terms of business model disruption, there's again, I always say, you know, any crisis is an opportunity for change. And so as businesses, as governments, as we rethink how we rebuild and go towards resilience in our next steps, I think there's a lot of opportunity for rebuilding. We've seen this with some governments in terms of funding, like in, you know, many businesses have signed on. Canada has actually made this pledge as they're thinking about rebooting the economies locally and doing work to do it in a way that is also climate friendly. So I think there's opportunity there. And then, you know, I think just some of the things, and I'm an internal optimist despite working on a lot of things that are sometimes not the easiest, I would say, is that we can fix this when we bring folks together. So really quickly, before we even get into this, and I know, Wendy, you started to touch on this, when we think about health, one of the things is that, you know, most people tend to, the first thing, when you think about health, you jump to healthcare, right? So do you have health insurance? Do you have a primary care provider? But, you know, as Wendy mentioned, I've spent a lot of time working on health equity. I've spent a lot of time working on what truly really creates health and well-being for folks. And what we recognize is that it's much, much broader than healthcare. It's influenced by a whole host of factors, which in the public health space, we refer to as the social determinants of health. We actually, as a practice with Deloitte, refer to them as the drivers of health. It's been one of my things for a long time. When we say social determinants, one, we've done focus groups on that, and that term doesn't actually resonate with a lot of people. They don't know what that means. I think the other challenge, and outside of academic circles, the other challenge is determinants makes it sound like it's a determined thing, that this is what it is, so this is what you get. And again, I think there's this piece around this ability to change all of these systems. So as we're thinking about this, climate change is also going to have an impact on all of these factors. If we're thinking, you know, it's conceptually, as we think about equity or health equity, it's really thinking about, you know, healthy people, healthy communities, and healthy planet, and really having that at the center, that people have this this right to thrive. We often think about either sustaining well-being, so that's like, keeping people healthy, or if they get sick, receiving care, and recognizing that framework is surrounded by all sorts of different things that have an influence. So technologies, cultures, structures, things around racism. We've heard a lot recently about some of the shifts and challenges, right, across the country, in calling for more equity and acknowledging some of the both implicit and explicit biases that have existed. But I think that this is all routed and grounded in the fact that there are all of these other factors that really have a deep impact on our health and well-being. So environment, obviously, the economics of what's happening, and social drivers. So, and there's interaction across all of these. And I think as we think about it to set up the framework of like health, right, from all of this, it's that climate change isn't only going to be a social determinant or driver of health, right? It's like one of the many buckets here, but that it's also a force multiplier across all of these things. So, as Wendy mentioned, I served on the National Academy of Sciences for the health equity work, and I would say if anyone's interested, I can send the resources after. Lots of really great examples of communities and action coming together to address these, but it's also a lot of the data that we have from across, for many years on how all of these different factors impact health directly. And so, climate change, so food is important. Having food access is important for things like diabetes and obesity and high blood pressure, et cetera. And we know with climate change that it's going to impact food in many ways. It can impact production, supply chain, nutritional quality, et cetera. Same with climate change in terms of the force multiplier, the impacts it can have on infrastructure. We were just talking about floods, economy. And so we could go through every single piece on here and we would see that it's a force multiplier. So I just wanted to set that up as we start to have conversations. And I'm seeing some chat, so I'm just going to make sure. I'm going to click over really quickly. Let's see. No, it's okay. Yes, reports, please. I will send them to you, Jonathan. We'll send them out. So really quickly, just moving along, health, it's interesting because one of the things is there's some really great work that shows, and you're all involved in climate change, and it's not as interactive, so I can't ask you specific things, but feel free to chat ideas and input. But, health is directly impacted, and we often don't talk about the health impacts, or we haven't been as much. I think it's definitely a growing area to think about climate change. But there's been a lot of discussion around how it's the global health threat of the 21st century. Obviously, we're in the pandemic. This is huge. It's caused massive disruption and terrible loss of human life. But again, I think climate change is an even a bigger thing that we're going to be needing to deal with. It's existential to our survival. What's really interesting is if you look at health sector on its own, it's actually a really significant emitter. It's very high energy usage. So you can see if you look at basically different things, so there's generation of electricity, heat, etc. This is an analysis from Healthcare Without Harm, but you can see that it's really quite pronounced in terms of what operational facilities are emitting, and the equivalent to global net emissions. And again, the United States is quite a large emitter when you look at the footprint across. The other thing in terms of kind of more globally thinking about health and healthcare affordability or impacts on health, we know that, and it's really interesting, we'll get into this in the insurance conversation, health insurers have not been thinking about climate change for the most part as explicitly, but we know that there are estimates in terms of the potential cost for climate change, right? So some estimates, EPA 290 billion in annual increase in health costs due to climate change by 2050, or 800 per resident. And and I love the thing about health is it can be very tangible. And so I think there's some really specific things we're already starting to see in the health space, and having worked with a number of colleagues and physicians and researchers doing this. So one of the most I think strong links is thinking about air quality. That's a very near-term thing. It's not even about the long-term impacts. This is just, you know, pollution, right? Because they go hand in hand. Thinking about allergy seasons are changing. And so with folks who have asthma, allergies, definitely an increased risk for or emergency room visits. Extreme temperature, this is one right now, right, that we're seeing. There was just a story in CNN. So extreme heat can have all sorts of different medical complications, which we'll get into a little more. Infectious disease, so changing vectors, and it's interesting because there's even been some, again, not this pandemic, but just in general, you know, as things shift and change, you know, new potential pandemics or other infectious diseases to deal with. And then obviously water quality. So a lot of these things have very tangible short-term impacts that we can see in the near term and not, you know, 10, 20 years out. There's also been case studies that have looked at different climate-sensitive events that have happened in the US. So as Wendy was mentioning, things from wildfire. Here in California, we know we've had some pretty significant wildfire seasons lately, to, you know, mosquito-borne West Nile virus in Texas and algae-borne blooms in the Florida coast. Again, when you look at the financial cost of these events, at least 10 billion is what was estimated for this study in 2012 from health-related costs. And so, again, I think part of the challenge is these are saying, you can't say that one event was from climate change, but we know statistically, as we start to see more of this, we'll have more of an impact on health, and then obviously more of an impact on healthcare affordability. So to focus a little bit more on extreme temperature and mortality, this is, and I'm sure you are all very familiar with this, in terms of the discussion that we were having, the implications of climate change as a force multiplier. As we've seen the greenhouse gas emissions go up, elevate, we've also seen mean temperatures going up as well. And so again, there's that piece with all of the social, economic, and environmental factors, but there's also the piece just in terms of the heat specifically in and of itself. And so, you know, in terms of, as we think about getting to this breaking point, it's a concern that we want to be able to address because of the impacts. So just to go into some of those, heat islands. So there's, again, there are different communities that are more at risk. The social, economic, and environmental factors definitely have a role to play with that. This is an example. This is this one, yes, from the EPA, the U.S. social vulnerability to environmental hazards. So just starting to map out in red some of the high. I'm from New Mexico, so I look at my own home state, which at baseline has a very high heat at baseline and is going up, but also a lot of vulnerability. We look at California, and we can see that there are many areas that are at very high risk. And it disproportionately affects different communities. The other thing is just in terms of heat, it's also the issues around urban heat islands. So some of the places, particularly in LA, I know you guys have done a lot around urban heat islands that can make the impacts even greater. When I was with the Office of Planning and Research, we did a lot of community planning work in terms of how to think about ways to mitigate some of this. So again, but you have to start monitoring it. You have to be thinking about it, and it has to be something on the radar screen to really start to think about how you're going to address it and whether it's an issue. So even making sure to think about race, income in some of the highest risk groups. As an example, outdoor workers, a lot of the farm workers are at very high risk. Obviously children, infants, and pregnant women, people who can basically get impacted by dehydration quickly, athletes, people who are homeless, living alone, without some of the things that would help to mitigate that. The other thing we're seeing from a medical perspective, it's not on the slide, but we're starting to see is different types of disease, and they're not completely sure yet, but it looks like some of the new forms of kidney disease are related to this. And so, you know, I think it's really important to recognize that there are all these compounding factors, but certain populations are at a much greater risk. And how do we start to think about that? And how do we start to control and work towards improving it? This is just, again, I think these graphs are always, they always shock me, but when we look at some of the hottest years recorded globally, this is, you know, global years to date, we see that 5 of the hottest years have been most recently happening. And I'm currently living in Sacramento, and I can see that we're having numbers, like very high numbers of days with significant days over 100. And so, you know, obviously that's not the one big data point, but you can see that this is really starting to happen in real time. And I spent a number of years in San Francisco, and you know, also could even start to sense a change even in the short time, over a decade that I was there. So again, I think it's just important to highlight that there is this risk with increased hospitalizations for all of these different reasons, the spread of infectious disease. The other thing is just thinking about some of the business side, even for medicine. We're seeing some of that disruption now with COVID, but supply chain disruption, and then obviously the broader piece around community health. So these are just some interesting graphs as well. So looking at global land and ocean temperatures, obviously we can see the warmest years recorded in the dark red. We see a lot of dark red on the map. The 2019 global temperatures, so looking at degrees cooler or warmer in 2019 compared to the middle of the 20th century. Again, that kind of darker red to yellow, above yellow are all of the places where we've seen increases. So it's one snapshot, but definitely looking over time. And then this is actually global temperatures, so looking degrees cooler or warmer in 2019. This is similar to the previous one, but you see it changing and going towards the yellow to the kind of orange-ish red at 4 degrees Celsius. So pretty shocking when you look over this time period towards the end of where we are today. Makes us think we really need to take action. So where does this land us in terms of climate change and health insurance? You know, you're probably wondering, like, are health insurers thinking about this? Are health systems thinking about this? And the answer is some. I think increasingly there are more groups that are thinking about this, and so I'll share some of that data. So since this is an insurance class, the National Insurance Commissioners actually does this climate risk disclosure survey. And it's really great. It captures insurance companies' climate change risk management practices. So as I understand, when they first started doing the survey, health insurers weren't necessarily responding. They then had to respond. So we actually have some really interesting data. Again, just in 2019 alone, it was $232 billion in natural catastrophes of insured losses, covering 71 billion. Some of the most costliest catastrophes have been in the last 2 decades. Again, we've had a number of really interesting conversations here in California over the last 2 to 3 years on wildfire, right? And that has many, as we know, who went through that, many direct health exposures and risks, from air quality to displacement to mental health issues to physical harm. But essentially this climate risk survey asks participants, so this includes life, property casualty, and health insurers with more than 100 million in direct premiums. And they have a set of questions that kind of fall into a couple of broad categories. And so, for instance, they ask about climate governance. Does the company have a climate change policy with respect to risk management and investment management? The next section is enterprise-wide climate risk management. So thinking about your company's process for identifying these climate risks and summarizing current risks posed to your company. Has the company considered the impact of climate change on its investment portfolio or altered that portfolio in any way in terms of a strategy or response? Climate change modeling and analytics. So is there any specific analytics that are going into this in terms of general terms and modeling? Stakeholder engagement, are they working with policyholders to reduce the loss caused by climate change or events? Some follow-up questions, and then internal greenhouse gas management. So are there specific plans for the company to reduce or mitigate their own operations? And so I'm just going to check because I see a thing, making sure there's not a question. Yes, UCLA has done a lot of work in this space. And I've seen some really great summaries coming out, and I will share some more with you guys at the end. But yes, acute respiratory, so, by going to net zero, and this is one of the things when I was with the state of California, we were actually doing a number of studies to look at the health benefits, the co-benefits of these climate actions. Thank you so much to, let's see, Dwayne Mueller for sending that along. So you probably are really interested to see what these survey results look like. And this is a high level. We actually requested the data. It's public data, it's publicly available data. The website is a little bit challenging to maneuver, so we actually just, we did a public records request so we could get all the data for the years that it was available to do our own analysis. But basically, this is looking at the surveyed responses. You can get this from the California Department of Insurance. Maybe with your speaker next week or the next class, you'll be able to dive into some of this a little bit more. But it was really fascinating. So the health insurers, and it's not surprising, when you look at the other insurers, obviously property and casualty, I think there's been a lot more kind of acknowledgement because the direct risk have been doing, as they answer the questions, I think they're thinking about this much more. When we look around climate governance in particular, about 23% of insurers in 2012 had a climate change risk management policy in place. So pretty low, given that we've just talked about all these potential impacts on health. It did go up quite substantially, but it was such a low starting point, it's still much less than all the other insurers as of 2018. So that's one point. Enterprise risk, when we think about enterprise risk, looking at health insurers to all other insurers, 62% of the health insurers had identified climate risk to their company compared to all other insurers. So again, it's higher than we would think given the conversation and discourse, but I think it's when you get into some of the nuances about how they're asking about it, but still lots of room for improvement. And then in terms of stakeholder engagement of health insurers encouraging policyholders to reduce losses or thinking about climate change influenced events, it's still much less compared to other insurers. So I think, again, this is one of the things I'm working on is I think there's so much opportunity in working with our payers, our providers, our systems to really think not only about thinking about this, but also doing things to take action to mitigate risk. So as we look at the climate risk disclosure, this is really interesting. Again, if you want to request the data, it's publicly available. The names aren't hidden, but we didn't put them in here just for privacy reasons. But there's this whole, I love looking at qualitative responses as well. And so there's this real spectrum across for some of the health insurers in terms of addressing climate impacts and even thinking about them. So from one company saying these, companies' operations aren't at all impacted by climate change. So there's no such risk. So without more information, it's impossible for us to predict any financial impacts to the business. And then you have a couple who are saying, corporate reputation, we're thinking about climate responsibility. We want to think about our reputation and performance. And so we're starting, our investors, our stakeholders, our employees, they care about this, we're starting to think about it. Again, you have, as you go along the spectrum, you have a couple that are saying, wow, again, this is before the pandemic. This data is, from a couple of years ago. There could be risk such as pandemic causing organisms, surges in claims, weather-related events, and increasing chronic illness. And then you have kind of all the way at the other spectrum, unified voice is going to be important across hospitals committing to address climate change. This particular organization is partnering with Healthcare Without Harm, ensuring, doing a lot of work to ensure sustainable, healthy futures for communities, and part of a collaborative, the Healthier Hospitals. So huge range of impacts to there. So I guess we'll work on the last couple minutes just to think about some solutions, and I think just tie it to some of the things we're seeing in healthcare in general and why I think this is a really opportune moment, particularly around health insurance as we think about these connections. So one is that, again, there's actually been a lot of shift in healthcare. There's a ton of shift happening in healthcare right now. And actually, one of the clients I've been working with, and it's a client I can talk about publicly, it's a nonprofit partner, is the Partnership for New York. It's a nonprofit that comprises big business leaders. Actually, Larry Fink from BlackRock is a member. And so basically what they're based in New York. They work closely with the government. When 9/11 happened, they put together a similar thing, which said, we're going to come together and take actions. What can we do? We've been working on the COVID response, and what's been really fascinating is thinking about a resilient system of health to be more resilient to disruption, climate change included, any kind of disruption. Some of the things that have emerged from those conversations, we interviewed the ecosystem leaders across the entire New York tri-state area to hear about things that they were dealing with COVID. But some of these things around technology, interoperable data, new innovations, it's really fascinating because there's a lot that is important to leverage in healthcare, which we haven't leveraged, that I think will be important to help make healthcare an ecosystem partner in climate change, including for health insurance. Really quickly, again, we talked about it, the United States is a major contributor to this in terms of health. So I think, again, just kind of that piece, not only is it part of the, it's a contributor, but there's also a big part that it's a solution given the finances. And as we think about some of the different players across the healthcare ecosystem, you know, obviously there are providers, so they're the ones who are seeing patients on the front lines. They are going to, you know, many of them are already seeing in terms of when some of these things emerge, direct impacts to emergency room visits. And then you have some of the plans, right? So those are the insurers thinking about how can they start forecasting events, how can they have an impact. And then you have life science and med tech who are in this as well, who are thinking about, you know, either the diseases as they, you know, how do they start to think about drug development, supply chain, all of that. And then the really interesting thing is this all moves is new entrants. So people who traditionally weren't part of the ecosystem who are starting to come into the ecosystem in health and how to think about resilience. And again, like all of these things are going to be more volatile and have this force multiplying effect with social and economic factors. In terms of healthcare, there's been a tremendous shift, and it's been really interesting to see. One of the things I've always been passionate about, trying to keep people healthy. So rather than waiting for people to get sick, which is kind of traditionally how things have happened in our system, we've seen exponential growth and disruption and this really rapid pace of innovation, right? So lots of data, lots of different systems. You know, what we, like even understanding a couple of years ago has just been so different than what we're able to capture now. And that's really coming into play in health, which is interesting because, you know, as the system is shifting, and this is where I think there's a lot of opportunity, connection to resilience and information, is this piece around data sharing, right? So a lot of this connection, like we don't even think about climate change and health necessarily explicitly. The data systems aren't connected, but as we start to connect those data systems, as systems start to adapt and you have more interoperable data, you can actually bring in environmental data, right? You're making sure that you have, that consumers get that data. It's not just like somewhere out there, but consumers actually have access to it, and scientific breakthroughs. So all of these things combined is what we think about in terms of the future of health. And what's been really fascinating with the COVID epidemic is a lot of these things have actually been proven to be accelerated during this time. What it means is we have these different types of healthcare's, you know, going through these massive shifts, and so we have a lot of this change. And so rather than, and this would be a whole other lecture, but you know, what we used to do is pay systems to take care of people when they got sick. As we're seeing all of these shifts, what's happened, and we've got systems moving to value-based care, is really starting to think about how do we keep people healthy, right? And paying for incentivize. So you have some systems like that that have been around for a long time. Kaiser, it's an integrated system, so their interest is really trying to keep people healthy. But we're seeing more shifts like that in the market. And so there's this shift towards well-being. And so as you see that shift towards well-being, you can't do that shift towards well-being without also thinking about climate and the impacts on climate and all of those other pieces. So I think for time, because we want to make sure we have time for questions, I'll skip these two slides. You know, and so again, in terms of tactics for climate action to improve health and well-being, I think there is this opportunity to think about co-benefits, to think about when you're doing certain actions that it both reduces greenhouse gas emissions, it unlocks these benefits, and it can have a range, both from working towards adaptation and resilience, because we know that we're kind of a little bit far down the line, but also mitigation. So when I was with California, one of the things that we did as part of the Global Climate Action Summit was work with a number of health systems in California. So we, Healthcare Without Harm is awesome. It's one of the other resources I'll send to you. They've done a number of publications, really terrific group. And I've been working with them for, partnering with them on different things, but we launched the California Healthcare Climate Alliance, which was essentially a number of health systems. So Kaiser, Sutter, Dignity, Providence, and the UC system, basically doing this type of work, saying, look, we recognize we're emitting, we recognize there are these health impacts. We can do so. We work together with them and the state to look at different policies. So, you see food waste here. There are policies in California that actually, require reduction of food waste. That's a big one for methane gas production. Energy consumption, thinking about energy policies. There are specific things also to hospitals in terms of hospital construction, et cetera. And so that's on the mitigation side and a lot of the urban planning and development. On the adaptation and resilience side was thinking about things, as I mentioned, like the work that I've been doing in New York, which is thinking about how you have data systems that are set up to support people, interoperable data systems, being able to address the social, economic, and environmental factors is really important. So I think that there are lots of things that can be done. This is just to say, as we work together, I think there's a lot of opportunity, again, looking towards what's possible, to start to think about aligning for a shared vision. So can you have the strategies aligned? So, making sure that people recognize when they're doing some of those actions that they are climate actions. Thinking about identifying opportunities to infuse climate conscious approach into operations, and then building a long-term roadmap for transformational change, again, that's bold and brings all of these things into alignment. I think that's it. I was gonna show one other slide, and that's this one here, which is in terms of different climate tactics for the subsectors. Again, if you haven't been in this space, as much, I think there's a lot of opportunity in terms of both across the different health players of where they can have an impact. A lot of the things you're probably working on, but slightly different framework. So, again, things that impact both mitigation and adaptation, some things more focused on mitigation, and then some things more focused on resilience. So I think on that, I will stop screen sharing, and I think if people can ask questions or raise their hand in the chat, would love to hear comments.
Yeah, that was brilliant. Thank you so much for that. I believe that we can unmute everybody, or if people just want to ask questions in the chat. I know Jonathan's been monitoring that. So,
Elizabeth, thank you so much. What a thorough and wonderful presentation. It's just been so helpful. There are two questions that come to my mind. One has to do with data. And you've had this unique position of being in the governor's office, but also now being with an auditing agency company. And my impression is that the insurance trade doesn't necessarily trust the data, or else they would be acting a little bit more aggressively in this area. So do you feel that we need more data, making the economic argument that we can avoid catastrophic costs to society and to our health and to our infrastructure if we make investments today? Do we need to make the case for those costs and do a better job of it? So do we need more studies like UCLA, or as Senator Henry Stern has in his bill, SB 1320, a very good bill that is moving through the legislature this year, to really make the next climate assessment specifically focus on avoided costs. I'll just stop with that. I'd just like to hear your response.
Yeah, No, I mean, so the fascinating thing was, as you know, because we've known each other for a long time. So, but one of the things when the former Governor Brown was interested in precision health and medicine, a lot of folks were like, what are you doing? Like, how are you working on that? One thing is when you work in government, as any of the folks in government know, it's like you end up being an expert on the things that you need to get done. So, but what was really fascinating is that precision medicine and precision health, it's really all about data. So it's how do you connect these disparate sources of data to have greater insight? So it's not just about genomics, that's one piece, but it's also social, economic, environmental, the microbiome, the bacteria that live in and on us. I think what's really fascinating is with the climate change links, like you have a lot of one-off studies, right? And we see that the microbiome's shifting, right? Like what we eat is influenced by so all of these things are interrelated. So, but the current way things happen is you have these siloed forms of data. I used to see this all the time when I was practicing, and this wasn't even for climate change, this was just for the social, economic, and environmental factors. If I had a patient with asthma come in, I would see them, I would talk to them, I would say, what's going on, what's happening in your environment. Now, maybe they lived next to a road that had like a highway, right? Or they had infestation with roaches or, something else, a mold infestation. Like there were a number of things, but that's not captured in the record. So when I would bill it, I would say asthma exacerbation, that was it. We didn't really have that link, right? With technology now, there's some really interesting things. There's the Propeller Health, which is actually an asthma inhaler that's GPS enabled, that you can track, you can GIS locate where people are having more exacerbations. As we get to be able to be more fine-tuned, I think to your question, Jonathan, we can start to actually link those. Think about all the emergency room visits we had during the wildfires, right? Like there's not it's like usually to get to that kind of level of understanding, you have to do a specific scientific study. And so the piece is, how do we start to actually make the healthcare system a learning health system so that we can have a closed loop and we can, to your point, get better data that helps us inform and capture that so that we know where the expenses are coming from. Because right now it's we treat patients, it's not necessarily the system. And to your point, like I think a number of systems are making those links, as we talked about. Insurers are as well. I would say increasingly it's been really interesting working with a number of insurers who are starting to think about these social, economic, and environmental factors. And I see my role as actually being able to shine the light on some of these links around climate, and that social determinants, climate is a social determinant and a multiplier. And we have to be thinking about that as well as we put these systems together to track better. Oh, you're on mute.
You're on mute, Jonathan.
As a follow-up, I think about the incredible amount of money that is spent. We have on the call Dr. Mark Futternick, who's an emergency room physician at California Hospital. And in talking with Dr. Futternick, as well as others, there are a lot of people who come into the hospitals with sort of heat-induced effects. And is there a way of trying to avoid those costs by doing a better job of protecting the public from heat events? And if that's the case, is there an insurance mechanism that we could put into play, an insurance product, where we do a better job of protecting a community through defeating the urban heat island, or by planting trees, or by providing cooling centers? Is there a mechanism by which we can use some insurance dollars up front to save insurance dollars on the back end?
Yeah, no, it's a great question. I mean, I think that's the whole point around value-based care, right? So this whole shift that we've seen in the healthcare, and a lot of people talk about the Affordable Care Act, and obviously that's been very controversial, but I think the biggest thing that came out of that was really trying to shift incentives. So before, the incentives, it was like a patient came in, you got paid because they came in to see you in the clinic, or they got hospitalized, so you got paid because they were hospitalized. Many systems are still set up like that. But that has shifted quite a bit. I think it's continuing to shift. I think it's going to be interesting with COVID and what happens, because some places did better when they're on those kinds of payment mechanisms. They're getting a fee for like a baseline amount of money for the patient. So that's been helped, because what we've seen is a lot of places had to stop their elective surgeries and all of that, which was a huge financial impact on health systems, billions and billions, and a lot of money. But I think it's shifting that incentive. Once you shift the incentive, I think then it opens it up for, can you reinvest in different ways? And so that's why we are seeing insurers now and providers starting to look at social determinants, right? So they're starting to say, oh, maybe if we actually provide some food services, that'll help us recap funds. Now, one of the challenges there is on the case management side, the data has been mixed. So there was the Camden study, which broke my heart a little bit. They did very high level impact case management and for the high cost, high utilizers, and they didn't see a big impact. But again, one study, and there are many studies. We know also there's this, there's other work doing predictive analytics. So that's one of the other things we work on within Deloitte. I'm part of the leadership team. We have a tool called Health 360. I'm working on trying to get them to put in some environmental data to be determined. But we look at a lot of social, economic, and environmental factors to impact risk to say predictively, you know, we now know that this is going to put you at increased risk for opioid opioid overdose, etc. And working, obviously can't say who, but we're working on putting some pilots together for some clients to do that kind of work. So I think to your point, there's an appetite and there's an interest. It's still early, it's nascent, but I do think that there's opportunity to do that.
Mark, I've unmuted you if you want to ask Dr. Baca some questions or make a comment or two on her presentation.
Sure. Well, I'll just make a couple of comments about the question you were asking, which I think is really important, sort of who would take on the responsibility of mitigating heat health illness. And so I'll start with something that Dr. Baca already recognized, which is that there's a major attribution problem. So we know that heat alone causes things like heart attacks and strokes, not just what we call heat-related illness. But as an ER doc, I've never written on a chart, myocardial infarction, which means heart attack, and then secondary due to the heat outside. It's like that. That's not part of the paradigm at this point. So there's no attribution. But the bigger issue is who should pay for that mitigation. I remember listening to a lecture at least 20 years ago from John Kitzhaber, of Oregon fame, talking about the insurance companies, Medicare being an insurance company in a sense, would save a ton of money buying air conditioning units for elderly people. But they don't feel like that's their job. Yet their job is to make money. They would save so much money spending that money, but it's not what we do. We don't install air conditioners. We're a health insurance thing. Yeah. So California is actually going to try to jump that with their what do they call it, Cal AIM, where they're going to start spending health dollars on social determinants of health. And some of the insurance plans are starting to do that too. But this is so much bigger when you start talking about mitigating climate change due to health. You'd really have to have one payer system. So the government who's doing it is also the one covering the lives. And so they've got the long-term interest in saving that money. If you don't have a unified payer, I think it'd be really hard to put together.
Yeah, I think I totally agree. I think there's that. I think the other piece is, and this is some of the work that we were doing with the California Healthcare Climate Alliance, I think trying to find the areas of alignment and co-benefit, right? So as anchor institutions, like hospitals, health systems are anchor institutions, meaning they're in the communities, they're making investments anyway. And so can they start thinking, because it's like, it's a benefit to them to keep their patients healthier. Again, when you get to value-based care, right? And so it's like, okay, we have community investment dollars. How do we spend them, right? Like I used to be on the community investment board for Stanford, and a lot of the investments back then, this was before the Affordable Care Act, because it was a while ago, and we still had a community investment board, but it was, much more clinical. So it'd be like, oh, we're gonna do a diabetes education class or whatever. And it was like, now you're starting to see places move upstream and say, instead of doing a diabetes education class, why don't we invest in a food system project that's going to provide healthy food, that's sustainable, that has a low economic footprint, carbon footprint, and we have that money. So I think part of it is also being kind of opening the box to think a little bit more broadly. Thank
you. Sabrina Bornstein, I believe you're on the call right now. could you talk about your experience at the City of Los Angeles in writing the city's climate resilience plan and its intersection with health and insurance?
I don't see Sabrina.
Okay, sorry, I was having.
Oh, you are there. Okay.
So I'm unmuted. Trying to think through so you were asking about, so yeah, I used to be with the City of Los Angeles as a Deputy Chief Resilience Officer, where heat was a major topic for us. But, you know, I think this is one thing where we were sort of early on in the conversation in terms of really trying to understand how to look at vulnerability through the perspective of heat versus, you know, oftentimes I think there was an inclination to look for solutions and opportunities based on the built environment in physical heat and where it's hottest versus the interplay between the built environment, the exposure, and the social vulnerability. So a lot of the conversation we were having was around how to look at social vulnerability, and then what are the, you know, and then also how do we respond to extreme heat events. You know, and so I think this is a really huge area of opportunity in the public sector is that, you know, the programs kind of look towards cooling centers. And, you know, that's to this point about air conditioning. And I think that was a real question we had with, you know, how do you expand access to cooling either, you know, in affordable housing units or through sort of a broader public approach beyond libraries and parks, which are important, but yeah, so I think that's the degree to which we were having the conversation was when I was at the city. I don't think we were quite at the point yet of talking about insurance implications. You know, I think that's still kind of a next step lens that cities are really trying to understand.
Thanks, Sabrina. And Louis Bloomberg, you're on the Insurance Commissioner Laura's task force on the insurance and climate change and the intersection of that. And we're going to hear from you next week, but you also are on the subcommittee on extreme heat. Could you perhaps ask Elizabeth some questions related to her presentation, or what are some of the issues you guys are struggling with in your task force? And are you muted, Louis?
I don't believe Louis has his audio on. Oh, I don't think he's there anymore. He did email me earlier today saying that he had to leave around 5. So.
Okay, I did see him reemerge onto this. So, are there any other questions from the floor? If anyone is interested in asking Elizabeth some questions, please make a note of it in the chat or by any other means. All right. Well, Wendy, I think I'm going to send it back over to you. And with incredible gratitude, Elizabeth, thank you so much for sharing your information. I think really thought-provoking.
Great. Yeah, well, I'm going to keep doing this work. So we'll see. We should do this again in a year and see the progress.
Yeah,
I would be game for that.
Thank you.
So thank you guys. So Elizabeth, again, thank you for the presentation. Your slides were amazing. We're going to go back to sharing my screen real quick. But part of our next discussion is, after you and I spoke last night, you kind of gave me some ideas to ask for this upcoming question that I have, which is our 10-minute breakout session. What we do is we break out for 10 minutes, people go into little breakout rooms, and they have this discussion. So today's question is, currently coverage is based on a fee for service or a payment when people get sick, whereas we should pay for to keep people healthy, as you said, value-based. So what is the best way to modify our healthcare, and talking about value-based care? So just a discussion kind of to continue on what we just discussed, but maybe in a little more depth of what people would like to see. I love the conversations, you know, with Dr. Mark Frederick about air conditioning units being installed. because that would be an ultimate cost saver rather than people spending money. So let's just have a quick discussion for the next 10 minutes or so about how we'd like to see things change.
Hey, Wendy, I think you're back.
I am. I know it's already 5 o'clock. We have a few more things to discuss that I'll very quickly go through, but very interesting conversation in our breakout session. One of the things I wanted to bring up was Jack Liebster brought up a very interesting concept with healthcare is if one carrier invests in a patient for their well-being and that value-based care, and then that client leaves to go to a different insurance company, then they've lost their investment. So there's not much incentive for insurance carriers to, for healthcare to focus that way. And it was a very interesting concept because, again, supporting the single payer healthcare. Most people wouldn't think of it that way. They would think, person goes from company A to company B, you have the right to switch it around, you change your job. But why would a healthcare company invest so much money in somebody to keep them healthy and keep them well, and then lose their investment if they transfer jobs? And I just wanted to bring that up because I thought that was a very important point to bring up. I don't know if you guys had similar conversations.
Well, on our team, yeah, there was a sense that Duane Muller from UCLA, I thought framed it in a very nice way, where there's we need to look at heat and wildfire in the same way that we try to have a healthy diet and exercise, that we need to sort of invest in the idea that we actually have some control over these things, and that people feel some sense of agency and responsibility related to controlling the heat and wildfire smoke that might visit their communities. I thought was very interesting. We had other great ideas in our breakout.
Yeah,
for others.
That's actually an excellent comment. I'm actually thinking maybe I should, in the past during our breakouts, ask for people to write in responses so we could tally these up and share them. But moving on, because we are at 5:05, let me just move on to kind of discussing what we have been going over in the last few classes, this continuation of coverage for captives, parametrics, insurance. So again, the slide that we're all used to, discussing parametrics, our new vicious cycle slide. So parametrics response to a triggering event, wildfire, hurricanes, storm surge, maybe heat. Maybe we can actually figure a way to add parametrics to heat, which got me to making a few phone calls to people, in addition to Elizabeth, who is still absolutely brilliant with her analyses and her data. But I have a friend, her name is Luann, and she works with something called living benefits. So I asked Luann if she could participate in today's class. She should be off mute. If you want to just introduce yourself real quick.
Sure. Hi, everyone. I'm Luann, and I specialize in living benefits, which is something that has been around for 21 years. Our company created it, and it was to fill a gap where if you have a chronic, critical, or terminal illness, that you actually have cash that's tax-free that you can pull from this policy. And the policy itself is something that encompasses quite a bit. It can help you with retirement. It really helps when you look at today's society. When Wendy and I were speaking, and she talked about the human health factor in what's going on today, it blew my mind, because that's an entirely different demographic than, when you look at people who are working in fields, and Wendy was talking about lung capacity and things that can happen to them. Something like this fills the gap that health insurance won't fill. And that's what is so profound about this product. It's affordable. It replaces what long-term care, I'm sure all of you are aware of, but it is something that is unaffordable to the majority, and it's something that's very, very hard to get. They have a lot of knockouts where you can't qualify. This does fill that gap. It fills co-pays, areas if you choose to want to have a non-traditional treatment for a cancer or some sort of a chronic illness, that you actually can do it. So Wendy and I were discussing it and just thought it would be great just to kind of share that little piece with you. I do have really quick
I stop sharing my slide for you.
Okay.
Yeah, because I was curious because when you and I were talking, it seems to fill a gap. I mean, nothing's perfect right now, especially with climate change.
Right. Well, this
was the graph. Yeah, this was the
graph.
Yeah,
this is a great graph. So basically, it's just generically showing you income versus expenses, and we know healthcare is very expensive, and especially when you hit an age where you're not bringing in as much money, or if you get hit with a diagnosis that you weren't planning. So if you look at the green line, you have your family's income, and obviously that income goes up for additional living benefits. If you get sick, your family's expenses keep going and your income slows down. You've got all these deductibles to pay, and in time you create this big circle of debt. Basically, that's what this slide is showing you. Well, between the red and the green graph on your right, additional income from living benefits is huge because based on the size policy that you take out, you're able to pull out cash. So an easy example is I have a client who had a heart attack, and she's young. She had it at 59, and she had a $500,000 policy. Because of the severity of her, as she calls it, her issue, she was able to actually get $250,000 tax-free cash out of that, which is sustaining her while she heals, recovers, and is able to, get her life back on track. So she uses it for working out, different types of anything that she can do to better her health today is what she really is using it for. So I think that's a great example, and I'm happy to share this with you. And
no, I appreciate that. I just, because I'm trying to think of alternatives, and if you can pull down your slide, I'm going to go up to our next slide.
One second. Here we go.
There we go.
Thank you.
Let me now go back to what we were discussing. So with these captives, this, I guess, could be an alternative, an existing product that exists, because the way that we've been working on our programs and our models, which this is from the last class, this addresses floods and fires. I don't think that this would translate well to healthcare, and I'm not sure if Dr. Baca is still on the call, but I'm not sure that this type of program, being a captive, having parametrics being the trigger, is something that would translate into healthcare coverage. So that's why, Luann came onto the call to talk about living benefits. I mean, is it perfect? No, we don't have a perfect answer for anything yet. We're still working on everything. But our hypothetical, going back to flood and fire, one of the things we discussed was flood and fire. So having a large area that you're encompassing for that coverage, some areas will have no exposure for flood. Some areas will have no exposure for fire. But if you have flood and fire together, usually the areas that are, low risk for flood are probably high risk for fire, and vice versa. So this kind of covers those gaps and keeps them intertwined. And then you have coverage for kind of everybody. And then, we talked about new entities. So you have the public entities, the properties, utility companies. And a lot of this we'll discuss in class 6 as well, with the Department of Insurance and Lewis talking about next steps with the state, what they're doing. But here are just some ideas that, we took from the very beginning. I think it was class 2 or 3, moving it forward with this. Property owners now include the industrials as homeowners. What other entities? And this is open discussion. If anyone wants to pull themselves off mute, or if Jonathan wants to check out the Q&A, if there's any questions in the chat box. But should transportation industry be added? Rail, transit, light rail, private corporations that benefit from the well-being of the city. Just other arms to add to this fund. And then one of the things that Ed Morales brought up, which was a fronted insurance policy. Now, a lot of people probably don't know what that means. I have the definition down here. It's basically you have to have a licensed admitted insurer that issues an insurance policy on behalf of a self-insured organization, such as a captive. And usually what's involved in there is you have a letter of credit on file. So even though the insurance carrier said, we've written this policy for you, it's just a fronted policy. It's kind of like a fake piece of paper. So if any claims come in, they have that letter of credit that the captive is actually paying the losses. The insurance carrier is providing the insurance paper. There's claims handling. There's usually a fee involved. So it's a really good mechanism to have in place for someone to manage a captive. I don't know if anyone has questions. We haven't really stopped for many questions on this yet. So if someone has something, let me check.
I'm not seeing anything, Wendy.
Nothing. Okay, perfect. And this is what I wanted people to really take. This is where we can open up the phones, take people off mute. And if anyone wants to dive in, because this is where all of the questions come in. Should there be a fourth arm with that transportation? How do you determine enrollment? I mean, you can't force people to participate. You can't make it, you can't mandate it. But how do you encourage people that it's for the benefit of everybody if we have a larger group of people? And we're talking areas the size of a city, areas the size of a county, multi-state. Jonathan brought up multi-state. What percentage are people paying? Should the property owners pay less than the utility companies? You know, how would that be determined? Available funds, retired assets. We talk about Measure AA, which was San Francisco Bay Area for shoreline refurbishment. What are the policy limits? We know that wildfires last year worldwide were 24 billion. So depending on how many people you're insuring and how many homes, fire and flood, everything together, is it 5 million? That's a pretty small number, and you're probably not going to get an insurance carrier to attach above that, but maybe it's 10 million or 50 million or 20. And then you have your excess carriers. Now, excess carriers, you know, if you go with a Lloyd's syndicate, you can just keep layering those excess layers right on top of it, just like Lego blocks. They all cover each other, one right over the other. And the further you get away from that primary layer, the cheaper it gets because there's less risk. But you'd probably want to build something up to at least 100 million for your area in case, worst case scenario, everything burns down. And then you have to determine with your actuaries and your risk engineers, what are the perils? What are the trigger points? How do we factor heat? Is it a certain temperature gauge you go past? Then you have to think about, well, someone who lives in Palm Springs is kind of adapted to 100-degree weather, whereas someone in San Francisco Bay Area probably wouldn't respond too well to anything over 100 degrees. So then you have those factors to think. So if people just want to, we have 15 minutes left in the class. If you guys just want to jump in with questions, comments, statements. I know Ed's been involved. Hopefully he's still on the call. Saren, if you're on the call, you had great comments in class 3, I believe. If you guys just want to jump in, anyone else who's got an idea, there are no wrong answers at this point. And we're going to hopefully take this to the next step in class 6, where we further refine this and discuss things. So I will stop talking now. Can't seem to get to the Q&A section.
Wendy, there's also the possibility that that our fellow classmates have come to the end of their workday and they're
a little tired.
Home. Yeah,
I understand. I just get really excited about this stuff because I just think it's neat. I'm a self-proclaimed science nerd, insurance nerd. This is my world coming together. So I guess on that, I will say thank you. And thank you, Luann. And I know Elizabeth had to cut off early, but I think we're actually beginning to hone in on something here.
Thank you very much, Wendy.
Thank you. And let me just get to, oh, we didn't do poll 3, but we might be out of time. Do you still want to do poll 3, Jonathan?
Sure, let's do poll 3.
Because I like this question. So our last poll of the day, folks, now that we've discussed insurance coverage and triggered how insurance carriers operate, have you done any of the following? Have you decided to revisit your own personal insurance and how it may be affected by climate change? Thought about how to use insurance when related to climate change? And then we have all of the above and none of the above. So we have a nice little split here. It's 40% all of the above, which is fantastic. And then a split with, people revisiting, but hopefully through learning some of the insurance knowledge, some of the terminology, you guys kind of get a feel for, hey, maybe I should look at something. Maybe I should look at my exclusions on my property policy because I was told it was, an all risks or an open peril. So just take a look at those forms. Call your broker. They're supposed to be your friends. The guys I know are awesome. So just ask the questions. There's no wrong questions. And before we leave, I just wanted to, I believe I have the slide for our next class. So same time, same place, July 21st. On Zoom, you'll get your invitations. Our guest speakers so far, Mary Sweeters, she's the outreach manager for Insure Our Future. Louis Blumberg, who I found out after I made the slide, but he will be speaking on behalf of the Department of Insurance. He's been with our workshop for over a year now. And Beverly Cole, who will be talking about social injustice. And on that, I thank you guys and have a great evening, and I will see you next week.
Thanks, Wendy.
Thank you.
Thank you so much. This was wonderful.
Thank you, Luann. I appreciate it.